I didn't do this last time, and I am remiss for not doing it. So I'll pop in the chat, just for folks who are entering kind of while we're chatting. If you guys want to introduce yourselves in the chat and kind of maybe what your interest in joining this webinar is, and thanks, Bree. Um, and where maybe what organization you are joining from, and I'll pop that in the chat for those who are joining. Bree, can you do the elevator music? Can you give us some bars?
I don't think anybody wants that.
Maybe the Jeopardy music.
We do a lot of webinars with Feeding America, and they always have whoever's hosting it just plays whatever song they're really into at the time.
Oh, I like that.
Yeah, so next time feel free to steal that and just play one of your hits.
When I teach, I just pop on lo-fi music.
Mm.
I don't know if I need to do that though, because it might put folks to sleep. But that's what I usually have on as background. All right. So I'll keep monitoring the waiting room and let folks in as they come in, but to be mindful of everyone's time, let's go ahead and get started. So today's episode is titled Understanding the Food Needs in Erie. And I will just give a brief introduction, a brief recap of kind of what we've talked about. Sorry, let me go back. Of what we've talked about last month and kind of our mission for this webinar series. So this webinar series, we started the Common Ground series beginning of last year, so 2025, kind of at the height of the aftermath of the 2024 presidential election. And our mission with this series is to really provide a space for community members, both local and we're branching out to our Union City folks this time. And I think I would love to continue doing that for our following conversations. But to give a space where we can really talk about some of these more difficult conversations. Our first series last year, we focused on conflict resolution, which is something that Opened Eyes really focuses on in our trainings and in our workshops. And I I speak for everybody probably on our conflict resolution skills, and it was really a really big topic of our interest last year with the change in administration. Um, um, so this year, this series, we're focusing on the various causes and impacts of poverty here in Erie. There's a ton of stigma around poverty, especially in our more individualized versus community-centered society. And throughout our series, we would like to focus on kind of three core areas. Basic needs, our youth, and then our finances. So this episode on food needs is our last one kind of centered on basic needs. And then in the next 2 months, we will focus on topics surrounding youth and youth wellness. So last month, we heard from Jenny Haggerty, the executive director of the Mercy Center for Women, and also Pastor Greg Busquet, the director of men's ministries at the Erie City Mission. And they spoke about the many intersectionalities of homelessness, addiction, lack of consistent resources, and other things that kind of create this cycle, this vicious cycle of poverty. And it's oftentimes very difficult to break. And there's many organizations in Erie that are working independently to provide care for these individuals, but ultimately we kind of focused on that it's a community effort. If you weren't at our last episode, you can always watch it back on our YouTube channel, which I'll have linked in our follow-up email, and also our channel name will be in our final slide. So we hope that these webinars will provide a spark for folks to continue discussing these issues around the necessity of providing consistent resources for basic needs, the importance of having difficult conversations with our friends and neighbors, and the need for more community-focused efforts. So that's my brief introduction. Now I would like to introduce our panelists for today. Um, my name is Jessica Hubert, if I didn't say that already. I am the webinar coordinator for Opened Eyes, and I will introduce our panelists. Let's start with Bree. So Brianna Watts, is the Vice President of Advancement at the Second Harvest Food Bank of Northwest Pennsylvania, where she leads fundraising, communications, and community engagement strategies to combat hunger. With a background spanning advancement, leadership, and direct service, she has held roles with the Mercy Center for Women, the Erie Community Foundation, and Big Brothers Big Sisters. She is passionate about building partnerships that create lasting community impact and expand access to essential resources. So welcome, Bree. And we also have Lenora Rum, who is the site pastor at McLean Church's Union City location, where she leads ministry teams dedicated to building community through dynamic worship and engaging small groups. She enjoys hanging out with students and serving the Union City community. When not working, Lenora loves exploring the outdoors, jigsaw puzzles, ditto, I love puzzles, and playing pickleball with her husband, Jim. Folks, that we have Zoom room today. So let's start from hearing from Bree, and she'll talk about her work with the Second Harvest Food Bank. And as we hear from our panelists, please feel free to put any questions or comments in the chat so we can discuss them later. So Bree, take it away.
Hello, everybody. Again, I'm Brianna Watts. I'm the Director of Advancement, well, I guess Vice President of Advancement now, here at the Food Bank. The Second Harvest Food Bank of Northwest Pennsylvania is the only food bank in 11 counties here in Northwest Pennsylvania. I can never name them all, so I have a cheat sheet. But we serve Erie, Crawford, Warren, McCain, Venango, Forest, Elk, Cameron, Clarion, Jefferson, and Clearfield County. So we are what's called a Feeding America food bank. Feeding America is the largest nonprofit in the United States. They are based in Chicago. Every state in the US has a Feeding America chapter per se, or food bank, that operates underneath that umbrella. Here in Pennsylvania, we have 9, 10 Feeding America food banks that we all take the various counties of Pennsylvania and take responsibility for them. Again, we are the 11 counties in that sort of northern western tier. In that, we also have 2 state associations that we belong to, which would be Hunger Free Pennsylvania and Feeding Pennsylvania. They are really the arm, the political arm, we'll say, food insecurity. So they are based in Harrisburg, Feeding Pennsylvania, and they do a lot of our policy work and really kind of bring all of us direct workers, direct food banks together to kind of work together on solving the problem of hunger. Here at the food bank, in brief, we have a lot of various programs that help feed people. We also partner with a lot of nonprofits. So we have what we call member agencies. There are approximately 400 of these member agencies. Lenora, who's on the call, she is one of our member agencies. So they get food from the food bank. I wanted to kind of touch base on just some fast facts. There's about 12 million pounds of food, and we're about to do the same approximate amount this year that we put out into those 11 counties every year. We are a staff of about 40-esque individuals, and then we have hundreds of volunteers who dedicate their time to our mission. It would take about 8 full-time employees to make up the time that these individuals put in throughout the year. So we would be nowhere without our volunteers. Some realities of hunger in Erie, we'll say, because we're specifically talking about Erie. The most recent studies from Map the Meal Gap, 1 in 7 people here in Erie County are considered food insecure. Food insecure by definition means that they do not know where their next meal is coming from. When it comes to children in Erie County, it's more like 1 in 5 or 25% of the children in our county are considered food insecure. So those are the individuals that we try to reach every year here at Second Harvest Food Bank. I don't know if you want to go to the next slide too. I can kind of go over what we call the food bank wheel. So people always confuse the word food bank versus food pantry. A food bank is essentially a warehouse. We have a 60,000 foot square foot warehouse in which all of these food products, frozen food, fresh food, shelf stable, milk, eggs, dairy, all of those things are in the facility that I'm currently at here in Erie on Grimm Drive. We get all of those food products from farmers, retailers, food drive, wholesalers, manufacturers, all different ways that food comes to us. A large portion we purchase. It comes to this warehouse, which then our nonprofits or our 400 member agencies can order from that inventory. We also have our own programming that uses that food. We have child feeding, backpack, school pantry programs. We have a Produce Express, which is just what it sounds like. We bring a semi truck of food to communities across our 11 counties and give about 50 pounds of food to individuals, meeting them where they're at in their community. So that's our Produce Express. We have a subset of that called our Military Share, which is used to target the food insecure veterans of our communities. So that would be anybody who's currently served or is retired from the military and their families. We also are the distributor of the PA Senior Box program, which is a USDA program here in the US, where we give low-income seniors food boxes. And we also partake in the Healthy Pantry Initiative, which is, we have a full-time nutritionist on staff who goes to our various pantries and helps educate the community on what are healthy choices to make, how to make meals with items you would find in a food pantry, and kind of reduce the impact of chronic disease upon our community. I'm trying to think if there's that's the wheel. So then we go to our nonprofits, and then those nonprofits usually feed our food insecure neighbors, and that's what we call them is our neighbors, because food insecurity can affect any of us. It's just not a subset of people. It's not a particular type of individual. Any of us at any point could find ourselves in a situation where we are in need of the food bank, and often those individuals are our own neighbors. Oh, perfect segue to the next slide. This is the realities of hunger, right? So how many people in our entire service area are food insecure? So these are the astonishing numbers that we get from Feeding America every year through a survey called Map the Meal Gap. And these are the target numbers that we are trying to serve every year. Oh.
Sorry, did you want me to go back?
Yeah, no, I'm just trying to think. I'm trying to give an overview of what we do, but I'm happy to answer more specific questions. The biggest question I always get is, how can you help? So perfect for the slide. Get involved. Get involved in what we do. You can host a fundraiser. You can host a food drive. You can volunteer. The most important thing that I educate people on is your money that you go to the grocery store does not go as far as the buying power of the food bank. So here at the food bank, we say that a $25 donation can feed one person for 3 weeks. That's just the sheer buying power that we have as an entity. I can barely eat one meal for $25. So that would be a fundraiser. People do all sorts of interesting ways to raise money for the food bank and for their neighbors. The one that's coming up the most soon is actually the second Sunday in May, which is the NALC food drive. So that is through the National Association of Letter Carriers, where people leave food donations on their doorstep, and your letter carrier will pick them up and then bring them back to the food bank. And then we disperse all of that food within our service area. So if you have any questions about the food bank or want to get involved, you can email us, call us. We are happy to welcome anybody who wants to help solve food insecurity.
Thank you, Bree.
You're welcome.
Next, we will head over to Lenora's slides.
Hi, everyone. So I'm Lenora Rum, and I'm the site pastor at McLean Church Union City. And I'm the director of our local pantry that serves the Union City Area School District. So the residents within that district. It bleeds over into Crawford County. So it's mostly Erie County, but it bleeds over to Crawford County in that district. And we have a pantry that draws from Second Harvest. Obviously, Bree just said that. And we do have the most buying power by being partnered with the bank. So instead of going out to grocers ourselves, we get more buying power through Second Harvest. And so in serving our neighbors in need, we are usually serving the rural poor community out there in Union City. And I think our biggest barrier there is transportation. Union City is a little bit of an island out there, uh, and it's actually becoming more of a bedroom community than a manufacturing community that it had been in generations before. And so transportation is at a premium, and a lot of people are relying on the local convenience store to sometimes buy their groceries. And of course, those are not the healthiest choices. So we really try to meet the needs in our own community, helping those families have healthy choices. We are one of the Healthy Pantry Initiative partners. So we're excited to be working with David from Second Harvest on that. We've been doing it for years, and I think it has help to educate our neighbors in need as well as provide them with the healthiest foods possible through Second Harvest. I'm not sure what all you need to know. We love serving our community, and it is a collaboration between um, neighbor to neighbor, our churches, our partnership with the Union City Elementary School is also a community school through United Way, and we also have family support centers. So we have close partnerships with those two entities as well when it comes to meeting the food and security needs in our community. It takes a village. It takes that collaboration across multiple entities to make it all work.
Awesome. Um, I have one question, I guess, from listening to the explanations of kind of the difference between a food bank and a food pantry. Um, would you say that um, you would see a certain population of folks visiting either of your locations, or as Bree said, it could really be anybody?
I'm going to jump in and I'm going to kind of paint a picture of historically what a pantry and a food bank are, right? So traditionally, on that wheel that we showed, a food bank is just that. It is a warehouse. Uh, and that warehouse very rarely, historically, had any direct contact with individuals seeking food. So when I talk about member agencies, that can be a food pantry like Lenora's. It could be a soup kitchen, a shelter, a backpacker school program at one of like the Union City Elementary School. Those are the entities that would have the direct contact with our neighbors in need. Unfortunately, the realities are that that model is not meeting the needs and has to be tweaked a little bit. So we find ourselves as a food bank, and the only food bank in those 11 counties, is finding that we need to meet people where they're at and fill those gaps. So that is why we have our own programming like Produce Express, Military Share, Senior Box, whatever that may be, because we still need to find and reach the people that maybe a lot of our nonprofits haven't been able to do. We are very lucky and blessed to have partners like Lenora, but she's few and far between to be as amazing as she is. It is a difficult task not only to work with that population, oftentimes for free as a volunteer. And a lot of them used to be in parishes or churches. A lot of those individuals' churches are closing. Nobody is taking up the reins of your beloved grandma who perhaps ran the pantry for 20 years and no longer can. The realities of the economy and where we live in Pennsylvania are things cost more. Cost of living is higher. We are not in an area where a ton of people are moving. So we're losing a lot of individuals too. So that's where the food bank really had to step in and kind of break that wheel and say, okay, we are going to take on some direct service responsibility, all still while following that cycle that Lenora is a part of, that really meeting the people in her own community. We can come into Union City. I can come to Clearfield County and hopefully bring the things that people need. But it's best when it comes from the people that live in that community, the people that know Lenora, that know the pantry runners, that know the leaders in Union City or in Clarion or whatever. They trust those entities. So that is where it seems to be most successful for us. So are we seeing the same people? I mean, yeah, people who are affected by the economy, people who are still trying to get out of COVID era. But those aren't those people. Those could be any of us. And I'll let Lenora kind of paint that picture of what she sees more on a daily basis.
Sure. So I'm happy to jump in on that local pantry. It's really a gathering place for the community. Now, I don't have this space that I dream about having where we can make it more of a community gathering. But like I say to our volunteers every week, we need to provide the happiest place to be on a Monday morning in Union City. So I want the neighbors who come in, we know them by name, we make it intentional to welcome them in by their first name and to ask personal questions so that we can remember some of their life circumstance and follow up on it. And the model of our pantry, to me, that helps promote community as well as preserve dignity is to make it a choice pantry. So you come into our humble pantry, you'll see shelves of food and a cart, and you, as a neighbor in need, have a small grocery list based on categories and the size of your family, and you go around the pantry and you choose off the shelf what you want. We're not boxing a box and saying you're going to eat these products this week. We allow them to choose that all the items they want based on the list. So we're preserving dignity, we're preserving community, and I feel like it's building a sense of neighborhood, I guess. I don't know. It really builds the sense of community as people come in and shop the pantry. Does that help understand a local pantry a little better?
Absolutely. Thank you both. I have a question from the chat. How can businesses or community organizations or even individuals be more than just donors?
Oh, well, at a local level, I say come in and be a part of the process and bring what you have to offer. So, if you are a gardener and you know how to grow vegetables, especially in containers or something, I don't know, step forward, let us know so that we can set aside some time and teach our neighbors how to grow some of their own vegetables. That would be amazing. Teaching cooking classes, you don't have to be an expert, but if you're good at saying, oh, canned tuna and rice with this other product go well together, help us food bundle and then teach our neighbors how to do that. I would love to partner with people who can walk alongside us in that environment. The benefit of our pantry's location, it's really a parking lot away from my church building. And there I have access to a kitchen and a dining room and, a lot more of a gathering place, so to speak. And so, having those types of partnerships for that individual in the community, step up to that pantry director and say, hey, this is what I can bring to the table. How does that work in your pantry?
Was the question, Jess, how to be more than just a donor? That was the question?
Yes. Individually or an organization or a community, how can they just be more than just a donor?
I would challenge that statement that you are not just a donor.
Mhm.
When you give your time, your talent, your treasure to any nonprofit, any community entity, you become part of the solution, right? So if you are doing a food drive or a fundraiser for the food bank or even for a pantry, you are helping push the needle um, in whatever area of poverty that we may be working in. So you raise money, you bring in peanut butter and jelly. That might be something we put in a box that we give to Lenora, that Lenora then gives to a mom who just lost their job and is wondering how they're going to feed their kids, right? So you are not just a donor, you are part of the solution, right? If you want to take it a step further and volunteer time, you can, like Lenora said, go to her pantry and physically move the boxes or take the things off of the truck and do some of that physical labor that, you know, not always easy for people of a particular age who are volunteering their time. Um, you can be a leader in the space and encourage your coworkers, maybe your boss, if you own a company, to be a partner in our journey. We have sponsorship opportunities where people can be a part of. We just built a free grocery store over on East Ave. That took community partnership to move the needle in that neighborhood, in that 16503 neighborhood. UPMC had to be on board. We had to have other nonprofits who wanted to be a part of that space. The Erie Community Foundation, their Emerging Erie Fund, they put their money where their mouth is and said, I'm going to give you a grant so that you can purchase the best quality freezers, refrigerators, marketing materials so that people feel dignified going to. Nobody wakes up and every morning is like, I can't wait to go to the pantry, right? That's a hard reality that many people don't want to ask for help. So if we can make it, like Lenora said, a welcoming space, a space where people feel part of a community and feel dignified in their choice and physically take them from the worst day of their lives and then leaving feeling like somebody actually cares about them and their family. That's what we want to do. So there's so many ways to get involved, and each of those ways to get involved directly affects somebody in need.
It's so interesting like how the universe is kind of lining up. So I had my full-time job is working at Mercyhurst University, and I just assisted with a debrief discussion group with a group of students who went out and did service this semester. And I had quite a few who were at food pantries, and I was trying to um, kind of instill what you were just about, like, not just working in the back. You're not just putting cans away. Like you are really helping out this this food pantry who you're just donating your time, but a lot of the students don't think that that's really anything. But really like showing and sharing the experience with the food pantry and that just donating their time is amazing. that's yeah, as you were saying, that's pushing the needle forward. I love that. I'm writing down some really awesome nuggets of just like one-liners. Like, Lenora said, promote community, preserve dignity. That's beautiful, beautiful one-liner. Um, so earlier, we were talking about some policy changes, that might have been, uh, causing an effect on, folks maybe using the food pantry or like grants or such like that. So, what policy changes have had the greatest impact on your organization or just food equity in general?
Go ahead, Lenora, you see it firsthand.
Well, um, I I don't know. Okay, this is where my faith is going to come in, and I'm like, God is always providing. Okay, so food costs are high, grant money is less than it was before, and yet we still have money in the bank that allows us to purchase food. And I'm just thankful for God's provision. So, that I couldn't probably say it any other way. I understand policies change all the time and we just adapt with the change and we try to figure out a solution moving forward and not get caught up in it. And we have enough. And if we don't have maybe canned vegetables, we have other alternatives that are healthy, or there'll be a cycle of we'll get more vegetables in another time. You know what I mean? We do the best that we can, and I really think we are combating food insecurity regardless of the changes.
This is a very tough question. Um, so we just did here at the food bank, I oversee our programmatic end. I also oversee our marketing and our development and fundraising initiatives. So on one hand, I will echo what Lenora is saying, that in the deepest, darkest time of crisis, it is amazing what our community has been able to do. Fundraising has been up for us since SNAP changes occurred. People are really wanting to get involved in what we do because they want to take care of their neighbors, and it's a really beautiful thing. The other side of that coin is our marketing team was overlooking our website, and for those who do not know, in the marketing world, you track every click, right, that everybody does on your website, and you want to see where that traffic is going. We were astonished to see that the same time in which SNAP benefits were turned off or stopped, we had like a 400% increase in individuals visiting our website and clicking our food finder. That's disheartening. I will say that the food bank in its creation is not ever going to solve hunger. We are not designed to do that. I'll give Adam Bratton a shout out. He is the director at the Nonprofit Partnership. He gave a training, I want to say maybe 2 or 3 months ago, about the intersection of government and nonprofits. No nonprofit will ever be able to feed people in the same way that the government can. And it might be a fundamental belief of some individuals in different ways, but it's the sheer nature of it is that we will never be able to make up the deficit of SNAP. It would take millions of dollars and millions of staff to make up those meals that we are going to lose for individuals who don't have access to those benefits. So it is hard. The reality of hunger in our neighborhood, in our community, in Northwest Pennsylvania, across the country it is difficult right now. But we are very blessed to have people like Lenora, people who run our pantries, who make it work. Our charitable food network, this is what we do every day. So if we have to be creative, if we have to maybe ask a few more people if they're willing to support our mission. That's what we're going to do, and we will do our very best to meet people with the needs that they have. But unfortunately, we will never be able to be the end all be all that that sometimes we're asked to be.
And that is so true. And so when, our budget is cut, the SNAP benefits go away, and we have increased neighbors in need coming, right? I make an appeal to the community, to the churches, to the businesses. And that happened when the SNAP benefits shut down for a while there. I couldn't believe the amount of food that came our way and money that came our way because people in our community understood what their neighbors were going through and they wanted to help. So, I would say, Second Harvest is probably really sweating it out, but in Union City, because of the generosity of our community, we were able to skate by and provide.
Food is fundamental, right? So if you think of the hierarchy of needs, um, everybody needs food. And from a fundraising perspective, it's one of the easiest sells because it's not political in nature, right? So everybody eats every day. Everybody knows what it's like to be hungry. And everybody realizes that if you aren't fed and are not fed nutritious foods, you cannot do your job. You cannot be a great parent. You cannot go to school and learn. Food is fundamental. What we always tell people about our newest marketplace or our free grocery store is people will skip going to the doctor. They'll skip going to the dentist. They're going to skip maybe their mental health appointment. What they won't skip is going to get food. So that really is what brings people in. And then when they get to us, when they get to Lenora's Pantry, perhaps maybe we can offer them something else that they need as well.
Yes.
So Raquel from the chat was sharing that the land that we have access to is ripe for cultivation. They've heard from elders back in the day, neighborhood gardens were frequent, and neighbors would trade from their gardens all the time. Their question is this a sustainable, accessible, partial solution for those that choose it? And are there any ideas on tenant landlord issues that could arise?
I know that Union City is a rural community. There's a lot more land out there, and we have gardeners. I wouldn't say that they're agricultural farmers like they used to be generations ago, but a lot of people have their own gardens. They do share. When we come to harvest season, we have a fair amount of people who want to share. I would love to see the educational aspect of a simple family garden happen in our community, and I'm working towards those ends now that we're in planting season. Um, I don't know what it looks like in an urban setting.
So we partner with tons of nonprofits who are in this space. So we are part of FPAC. Sister St. Joseph has neighborhood network gardens that they do urban farming. When it comes to large scale farmers here in Northwest Pennsylvania, we have a specific farmer actually that I can think of who donates acres of land to grow sweet corn that he just donates just to the food bank, and then we give to our member agencies. So is this something that we are currently working with and exploring? Yeah, absolutely. I do think it is one of the many tools that people can use to help end food insecurity. Unfortunately, it's not the answer, I don't think, personally. Um, Elderly, disabled people. Um, I don't, I have a garden, a 6-bed raised garden at my house, and my husband is out there hours tending to those plants and constantly putting fertilizer and that costs money. So is it just another tool in our toolbox? Absolutely.
Yes.
Is it the end to food insecurity? I don't think so. Mm-mm. Look up the master gardeners, though. If you are learning about how to build a garden, or want somebody to come and teach you those skills, there are many nonprofits who are in that skill and are happy. FPAC, another one of them that we're happy to come out, share seeds and knowledge with people who are interested in wanting to grow.
Chris N in the chat says to Lenora, says that Lenora, you're a busy lady in your role at the church. Where do you see the crossover between your ministry and your role at the food pantry?
Yeah, I love Chris. He's one of
We
his
love Chris
biggest
too.
fans. Chris is awesome. So yeah, Chris, thanks for that question. And I would say that there's a natural crossover because we're meeting the needs of people physically as we do in the church spiritually and emotionally. And so I think what really blends the two together is just getting to know the people. And when you hear their story, like, they're going through a health crisis. Um, I know that one lady came in with that concern months ago, and I just really felt compelled to dig a little deeper. So I helped her walk out with her groceries and I asked a few more questions. And then she asked for prayer support, and we were able to do that right there. I mean, that is ministry happening right there. And I'm thankful to say that she is healthy and well and loves coming to the pantry and getting what she would say her healthy food. And so uh, I think that in my job as a pastor, it's a natural transition to a food pantry and the people that you meet there, hearing their stories, getting to know them, and embracing them for who they are, where they are.
Kind of going off of that story that you shared, how would you say that food insecurity affects physical health, mental wellness, academic, or workplace performance?
Oh, it absolutely goes back to what Bree said. Food is medicine. We've been hearing that more and more. And if you don't have access to healthy food, your health will decline. Then that's just a snowball effect to everything else to your life. And um, that's why that local pantry is so vital. And we need to really get good at breaking down the stigma of going. More people qualify for the pantry than they financially think they do. And I think it's kind of, I know it's hard to ask for help. I get that. But really, what keeps us from asking for help is generally our pride. And if we could put that aside and walk through the door, I would really like to think that your local pantry is there with a smile on their face and say, "Yeah, hi, Sam, how can we help?" You know what I mean? Like, know them by name and see how they can help and meet their needs and healthy food. It starts with healthy food.
Even from a chronic disease angle, David, our nutritionist, now I'm not a doctor by any means, but if you have diabetes or hypertension or high blood pressure, he, through the Healthy Pantry Initiative, will put what the grocery stores and what we call nudges. So we will put small signs on different products that are maybe low in sodium, or perhaps no sugar added in this can of mandarin oranges. So we will put these nudges out. Another one I can think of is we have white rice next to brown rice. Then there'll be a little nudge that says, this is a high fiber choice. So we are not going to tell people what they need to eat, but we will educate them on what are the better choices for them. So generally speaking, in diabetes land, if you can lower your BMI, if you can lose some weight, type 2 diabetes tends to improve. So these are the sorts of things that we combat through a healthy pantry is how can people use food as medicine to make better choices to help alleviate some of the symptoms of chronic disease, and encourage them to work with their doctors. We actually have a partnership with Geisinger, and I think this is also happening, as far as I know, at St. Vincent. If doctors are screening individuals for health concerns and they're noticing that food insecurity is something that they also experience, they're referring them to our network. So I get referrals from Geisinger saying this individual is in need of healthy food options. Can you help them? And that's the perfect example as food as medicine, is working with the medical community to help alleviate some of these chronic diseases that people have.
And the beauty of the Healthy Pantry initiative that Second Harvest hosts, they give us as directors and our volunteers education on helping people who have dietary restrictions. And that has been hugely helpful for us in food bundling that we do and some of the choices that are available at the bank for us to be able to put on our shelves. So it's kind of a full circle thing there. Most of us are not in the healthcare profession. We haven't been exactly educated on the nutritional foods out there. And Healthy Pantry Initiative has been so vital for us in Union City to be offering the best kinds of food for our neighbors.
I'm glad that you talked about the kind of working directly with the medical providers, because I think it's interesting though, because if somebody is going to that medical appointment and they're letting somebody know that they're answering a question, or somebody's referring them to a food pantry, but you had also mentioned that people might also skip appointments, um, so they're not getting that referral. Um, so if there's ways that we are, or that you are trying to intervene and meeting people where they're at, but it still seems like there's still people who are going to be slipping through the cracks. Um, and like you were saying, like that these are not meant to be the be all end all solving of food insecurity. I don't really have a question. It was just a comment and an observation. Um, okay, another question from Raquel. Is there childhood education happening? I.e., as you were saying, food is medicine. Do you know of any programs that are kind of teaching children the importance about food?
I do know that in Erie, there are a few schools that partner with members at FPAC. FPAC is Food Advisory Policy Council, I think is what the abbreviation is. They do community gardens and school gardens and teaching children the importance of growing your own food and food as medicine. As far as like curriculum in the public schools, I don't know the answer to that. That's a whole nother realm in which I am not affiliated with. Yeah, I don't know the answer. Lenore, do you know anything about that going on in Union City?
I don't. It's a really great question, and now it makes me curious, want to follow up because it would be interesting to know. I'm not in the educational realm necessarily. I just partner with them, so I feel like, yeah, I need to ask that question. It's a great question, Raquel. Thank you.
Food as medicine is a concept that is trying to get passed legislatively that has not necessarily happened just yet. But there are initiatives for doctors to essentially prescribe healthy foods to somebody and then have insurance companies cover the cost of that food. That is not something that is currently happening, but there has been a lot of movement in Feeding America Network, in food banking networks, and in insurance companies that we all work with. So look into that if you are interested. And I encourage you to write your current legislator about the importance of adopting the food as medicine policy and that endeavor.
So along those lines, I have one more question, and then if there's any last minute questions in the chat, please feel free to pop them in there. But my last question is, how can we shift from more of a reacting to food insecurity, to actually preventing it?
I think it goes back to what Bree said earlier. I'm not sure that we can really prevent food insecurity as much as we all want to. It's certainly a goal for us to have in front of us. I just think we need to be very judicial in using all of the tools available in our toolbox to keep combating it.
Can you ask that question again?
Yes. How do we shift from reacting, more of a a reaction to this issue of food security, to actually preventing it?
I am going to put on my Brianna Watts hat and be separate from all of the other things that I do and have done in my career. I have spent my entire career in direct service in some shape or form, and then most recently in the more of a fundraising and administrative realm. In my experience, the only way that we are going to be proactive on any sort of, whether it be child abuse, whether it be food insecurity, whether it be housing, homelessness, is if we as a country come together and decide that that is the priority that we would like to solve. So if SNAP is a great use of resources, or SNAP equals food stamps, of the government coming in and saying, I'm going to take care of these people, and in hopes that they will be able to sustain feeding their families, which will keep them hopefully out of making other choices that they may be forced to make, right? So if we don't have enough money for food, are we doing something that is crime related to obtain those resources? Are we, because people are going to do what they need to do to take care of themselves and the people that they love. So is it a priority of the government to continue to fund programs like SNAP so that individuals no longer have to make the difficult choice between feeding my family, getting medicine, paying my rent, paying my electricity, my water bill, as a people who are we as Americans? If we can't take care of the individuals that live here, what are we doing? I mean, that would be my own personal Brianna hat. I also wanted to end with too that Feeding America did a study recently that 60% of the people that we see, and that may be different from Lenore's perspective or individual pantries, are employed. So these are not the picture that often people are painting of someone who's using the system or abusing resources. That's not really ever the case that we see. These are the unemployed, the underemployed, the underpaid, the individuals who have a chronic health, or maybe they just found out they have cancer and lost their job. These are individuals who, for a certain period of time, not indefinitely, need us to help them become sustainable, self-sufficient, and get them back on their feet so that they can go back to work. They can become members of the community that help others. That is the reality of what we see. It is not the picture that often is being painted.
I completely agree, Bree. It's generally those who are underemployed, un unemployed for situational circumstances, and I couldn't cheer you on more with we as Americans need to do what we need to do in taking care of each other. And that is the Lenora hat today.
Thank you.
Yes, I appreciate both of you. It's very difficult to say out loud, I think, but it's necessary to say out loud that if we're going to say these values of being Americans, we really need to show it and to, yeah, difficult things to say. That's why we're doing this, though. That's why we have these conversations, is to try and help us say these things out loud. Um, So I don't see any more questions in the chat, so we will conclude our webinar episode. I want to give a huge, huge thank you to Bree and Lenora for your candidness, your expertise. Again, my favorite nuggets of wisdom that I just wrote down. I really appreciate those as well. Um, our next webinar is obviously today is the 24th. So our next one is June 26th, and we're going to talk about the disparities in when education isn't actually equal, working to close those education gaps in Erie. So look out for the registration link for that webinar. This is all of our contact information. As I said earlier, you can follow us on YouTube where you can see some of our past episodes. This is where you can kind of reach out to our OE staff. And we also would like to, we did a little raffle while we were doing this. So we have two winners. And I apologize if I mispronounce, but our winner for an OE swag item is Hoan. Um, Nguyen, I believe is how you pronounce this last. And for a free 30-minute consult with OE is Raquel. I don't think Raquel Quarter. Yep, Raquel Quarter. So if you can just pop your emails in the chat, so Kathleen Washington, she can get in contact with you for your swag item and your consult. That would be awesome. But again, a big thank you to Bree and Lenora. And hopefully, wherever you are, the weather is wonderful because it's wonderful here in Erie. So please enjoy that wonderful wedding, and have a great weekend.
Thank you for having us. Thank you so much for these really important conversations. Shout out to Open Eyes. Wonderful group
Yes,
of
thank
people.
you so much. Yep.
Thank you.